All right, good afternoon or evening, everyone. My name is Kate Holmes, and welcome to the Dementia Society's January Alzheimer's Awareness Month webinar. I am the Director of Development and Education here at the Dementia Society of Ottawa and Renfrew County, and we're very pleased that you could join us today for this session. Before we get going, I want to tell you a little bit about the Dementia Society, who we are and why we're doing this, and what we do every day. So today, as you know, you've registered and are joining the Understanding the Link Between Concussion and Dementia. And we're joined by two great people to tell us about this. Tim Fleiszer, who is the CEO or Executive Director, rather, of Concussion Legacy Foundation Canada. Tim is the first player in the Canadian Football League history to win 4 Grey Cup championships with 4 different teams. And he graduated from Harvard and currently works as a sports agent and a consultant. In 2012, Tim founded the Concussion Legacy Foundation of Canada, where he currently serves as the executive director. And Dr. Carmela Tartaglia. Dr. Tartaglia maintains a cognitive behavioral clinic within the University Hospital Network Clinic in Toronto, where she sees patients and with neurodegenerative diseases with a focus on frontotemporal lobal degeneration syndrome. As well, she's interested in the delayed effects of concussion and sees patients with post-concussion syndrome and those with multiple concussions who are at risk of developing a neurodegenerative disease. So why are we doing this? If we go to the next slide, please. I'm going to keep you in suspense. I'm not going to tell you why we're doing this test. I'm going to tell you the process for today. So this webinar is being live cast on Facebook and recorded for future on-demand viewing. And everyone but our speakers and event coordinators are muted today. If you have any questions that you have, we did solicit questions in advance, but if you have questions now, we invite you to put them in the chat on Zoom or on Facebook, and we will be monitoring that and saving a little bit of time at the end for our guests to speak to those questions. Please, for your privacy and that of others, do not share personal health information, either yours or anybody else's. And any medical information shared in this webinar is an information resource only and not to be used or relied upon for any diagnostic or treatment purposes. This information should not be used as a substitute for professional medical advice, diagnosis, or treatment. So today we're going to just run through a few things, but to tell you about the process, we're going to do that. I'm going to chat briefly, and then we're going to invite our speakers to speak for about 15 minutes each, and then we're reserving some time at the end for some questions. As I mentioned before, we offered the opportunity for people to submit their questions in advance. We got some great questions, some of which I think will be addressed here in the presentations by our two speakers, and those that aren't, we hope to get to at the end. So who are we? The Dementia Society of Ottawa and Renfrew County is a local charitable organization. We've been around for over 40 years, and what we do is support people living with dementia and those who are impacted by it. So people who may not be diagnosed, are diagnosed, and the people who support them typically. So care partners, spouses, siblings, children, as well as other loved ones and friends. We provide this service free of charge, thanks to the support of the community, people like you, as I say at PBS, who kindly support us through donations and sponsorships, as well as receive some funding for some core services from Ontario Health. And as dementia numbers increase, and we know they are increasing, currently the number that we tout, so to speak, is that there are 24,000 people in Ottawa and Renfrew County currently living with a diagnosis of dementia. And that can take many forms, many types of dementia. And we know that those numbers will be increasing up to as many as 60,000 by 2050. Next slide, please. So what we do, as I mentioned earlier, is we provide support to people living with dementia and those who are impacted. So all along the dementia care continuum, brain health through all sorts of caregiving topics and end of life. Grieving, you name it. So we don't do research, but what we do is interpret research, and we find people who can give us the answers to the questions that we know that you have. There's some seminal pieces of research that I know will be cited here in the presentations as well, but dementia is a very challenging disease. We all know that, and what is encouraging. There are a number of encouraging things, including the research that's going on, but we learned, or it was sort of substantially reported in the Lancet report in 2020, that up to 40% of dementias are preventable. And so tonight, that's what we want to talk to you about. And so there's all kinds of research going on that's adding to this body of information, which is very helpful to us. And you'll hear about some of that as we go along. Armand, the next slide, please. And just wanted to call out the dementia strategy, the Canada dementia strategy that's put forward by the federal government. Has 3 pillars, which are to prevent dementia, to advance therapies and find a cure, and to improve the quality of life of people living with dementia. So we really play in the first and the third of those pillars, the prevention and creating awareness around that, and helping people in dementia. And as we said there, 40% of dementias can be prevented, and there are 12 risk factors. Typically, as the Dementia Society, we have talked about risk factors that are more disease-related, heart disease. We've talked about mental health. We've talked about sex differences in dementia. And tonight, for the first time, we want to tell you a little bit about brain impacts, chronic traumatic encephalopathy, CTE, and concussions. Next slide. So I think you're going to hear more about this too, in terms of what you can do about it. Like I said, what we want to do is offer very practical advice. So at the end of this, what can you do about it is to reduce the risk of brain trauma in your settings. You'll hear more about what settings are higher risk. Anyway, I think I'm going to hand it over quickly to the experts because they are the experts in that. So as I mentioned earlier, we have this evening Tim Fleiszer from the Concussion Legacy Foundation, who will tell us a little bit about the work that they do and the support that they provide. Tim.
Thank you very much. I appreciate your time and appreciate everybody being here. Concussion Legacy Foundation started in Boston in 2007. My college teammate, a gentleman by the name of Chris Nowinski, who had been wrestling in the WWE, had a series of bad concussions, didn't realize that what was wrong with him, and ended up in Bob Cantu's office and found out that, in fact, he was experiencing post-concussion syndrome, and realized and correctly ascertained that there was this hidden epidemic in sports happening right under our noses. So one of the things is, first of all, let's start in talking about concussions. Up to 80% of concussions are not diagnosed, recognized, or properly treated. And so even when it comes to acute concussion, we know we're missing a lot more than we actually catch. And this is important because if you think about brain injury in our society, and the story I always tell on this is, if you watch a movie and the plot is that the hero wants to disable the villain without hurting them, what do? They knock them out. And 5 minutes later, the villain wakes up and everything goes on. But in fact, that injury can actually severely impact somebody's life. So we just have this very, very glib approach to brain injury, when in fact, the consequences are far more serious than in a lot of cases people realize. And so the first thing is, you don't need to be knocked out to have a concussion. There's all sorts of ways of which concussions present. Could be seeing stars, having a headache, feeling dizzy. And so for somebody who's thinking about dementia and thinking about risk of dementia, it's worth thinking back through somebody's history and, were you ever in an accident? Did you play sports? Did you serve in the military? And if in all those processes, or if in all those activities, it's quite possible that you may have been exposed to brain injury. Now, the other thing that people don't necessarily realize is they think in terms of the long-term risk, and because there has been so much media attention on athletes and the great work that Carmela Tartaglia and her group, including pathologist Gabor Kovacs, are doing at the Canadian Concussion Center, and the work that's been doing through our US group at Boston University, people are paying more attention to this issue and are paying more attention to the long-term effects of brain injury, of which elevated risk of dementia is unfortunately one of those risks. But you need to realize, and everybody needs to realize, that it's not just concussions that put people at risk, it's any sort of repetitive head impacts. And what I mean by that is that we've been able to diagnose CT. Right now, CT can only be diagnosed via autopsy. We're not able to diagnose it in vivo. And so one of the things is that we've seen people present with chronic traumatic encephalopathy when they've never had a diagnosed concussion. So it's not just about concussions, it's actually about repetitive head impacts. One of the other things that people haven't really associated is brain injuries and mental health. And in fact, one of the best studies in the world actually came out of CHEO in Ottawa, in most of the folks here's backyard. And what they did is they looked at a group of pediatric patients that had sustained orthopedic injury and another group that had sustained concussions. And what they found was that there was a 40% increased risk for mental health issues, psychiatric hospitalization, and self-harm as compared to the orthopedic injury group. So that's pretty significant. So one of the things that people are now starting to pay more attention to is the effect of brain injury on mental health as well. You can go to the next slide. So if you or a loved one is potentially suffering from the effects of brain injury, whether that be dementia, whether that be mental health issues, if you're a civilian and you scan the QR code on the left side of this line, where you see /helpline, or if you've served in the military and need help because you feel like it's your brain injury or your mental health issues or your dementia is specifically related to your service in the military, you can scan the QR code on the right and you can come to our helpline. We have coordinators there that will help put you in touch with the best available medical resources. So we're not a crisis line. If you're in crisis, there are resources for that. This is about trying to find best available medical resources depending on where you are in your geographic area. Next slide, please. So some of the work that we do at the foundation, we work with schools to do prevention work. We do camps where we actually go on with young athletes and show them proper body contact technique, tell them about the importance of reporting brain injuries when they see it in their teammates, because the bystander model is the best way to do that. And we also do challenges where we look at solutions to brain injury. And the picture on the bottom left is the parents of Rowan Stringer. Rowan was an Ottawa, was a young rugby player playing in Ottawa, 17 years old, who had a concussion, didn't tell anybody, didn't tell her parents, didn't tell her teachers, didn't tell the coaches. She did tell her friends, and she went out and tried to play in a subsequent game, and unfortunately ended up passing away as a result of second impact syndrome. And I just want to recognize her parents, Gordon and Kathleen Stringer, who have been tremendous advocates on this issue across Canada. So if anybody ever wants to get more information on the Concussion Legacy Foundation, on prevention strategies, some of the research that we do, and Dr. Tartaglia and her group is one of our research partners. Another one of our research partners is the Brain Health Imaging Center at CAMH, specifically Dr. Vazdev and Dr. Boileau. And what they're looking at is the ability to diagnose CT in vivo through using radio tracer and then subsequent PET scans. And so they've been looking at athletes, looking at military, and they're doing great work. And so if anybody's interested in that or needs treatment help through our helpline or a support line, that is what we are here for.
Great. Thank you, Tim. And I think we can just go directly to Dr. Tartaglia.
Okay, I found it.
Thanks.
Okay, great. Well, thank you all for coming, and it's my pleasure to speak to you. I think, as Tim has already alluded to, concussions are very common, and although we think most about concussion in sport, and I think that actually has brought concussion to the forefront of our I guess, everyday thinking, everyday knowledge of how deleterious these can be. So, we're grateful there, but lots of concussion happening outside of sport. Okay. So you've probably already heard that they're very, very common. And like I've said, sports are very, are where we think about them the most, but motor vehicle collisions, military, falls, abuse, very common. And, the numbers that are always thrown around are in hundreds of thousands, across the world, millions. They are a huge underestimate, because the issue is that most people do not get medical attention for concussions. Most people, when they have a concussion, it goes away within a day or two. They get a few symptoms that day, the next day, and they don't really seek medical attention. And so all the numbers that we see are vastly an underestimate. Next slide, please. So what can happen after a concussion? And Tim has already talked about this. There can be a lot of mental health issues, but, cognitive symptoms are really common after concussion, physical symptoms like headache, dizziness, fatigue, people complaining that they can't think straight, they're unable to concentrate. And depression, anxiety, very common after a concussion. And, you could imagine these symptoms, there's a heterogeneous group of symptoms, and actually we've recorded over 56 different symptoms that people can have after a concussion. Next slide, please. And why do people get a lot of these neuro symptoms is because of where we think some of the injury is. We think, when you think of where the bulk of the injury is for concussion, a lot of it is in the frontal lobes, the anterior temporal lobes. And so you can see on the far right, that red area, the green area, the yellow area, those areas are the parts of the brain that are closest to bone. And so when you're getting hit, there's, a force that is delivered throughout the brain, but some of the brain that is most vulnerable are these areas. And those areas are really important for your personality. And so that's why sometimes people will talk about changes in their personality. The brain stem, so that's that area that you can see there in green, and in the middle picture is the chunky area right in front of the cerebellum. That area has a lot of neurotransmitters, and a lot of these neurotransmitters are really important for mood, for paying attention to things, concentration. So, the injury that happens to the brain, and I think that's the most important thing to remember, it is a brain injury, is not a big injury that we can see, but it does affect the brain in some way, and that's why we end up with the symptoms that we end up with. It's not because of something else. And the important thing is, as Tim has already alluded to, a lot of times people don't even know they've had a concussion. Sometimes, people had these subconcussive blows, so they're hit their head many times, don't really notice anything, but, something's happening to the brain. The other thing is that sometimes people will feel something and they didn't even get hit in the head. It was like a force to the other parts of the body, and those can be as important. But you could imagine how difficult it is to quantify those. Next slide, please. And so, although we think about concussions in the in sports and in the very young, as you can see here, the other population that has an increasing number of concussions are the older people. So people in the later stages of their lives, after the age of 65, start to accumulate more concussions. They're also at increased risk of, having persisting symptoms, as anybody else can. Next slide, please. I don't know why there's some part of it missing, but actually this comes from, a recent report that tried to really understand how many concussions are actually happening in Ontario. We don't really have a good sense as I said, a lot of times they're getting missed and people were throwing these numbers around. Yes, exactly. So the numbers in Ontario are about 164,000 per year. And you can see that there's over 30,000 in older people. And so, this is a concern. We have underestimated a lot of these are numbers coming to us from administrative databases. That means that these are people who are interacting with healthcare system. So lots of concussion, not even, relating to healthcare, and those would not be documented in here. How are people getting injured? Sorry, just go back 1 second. Oh, you can, yeah. So falls are a big one. And, a lot of times from the fall, you can end up with a more severe injury when you are older. But also, you can also end up with just a mild injury. Next slide, please. So in the older people, the biggest culprit for concussion are falls. But second, and very important, are also motor vehicle collisions. The 70-year-olds have the highest accident rate per kilometer from any other age group except for young male drivers. Suicide, unfortunately, is also a leading cause of injury in those above the age of 65, and of course, elder abuse. Next slide, please. And so the thing is that when older people come to us for an assessment, it actually isn't as easy as when a younger person. So think about how you make a diagnosis of a concussion. Actually, we have no markers for concussion. Basically, something happens to somebody. It could be a fall, it could be a hit, it could be a motor vehicle collision. And then they come to you and say, I had this injury and then something changed. I can't think as well. I cannot remember as well. I have a headache. I can't see well. My balance is off. So what about if, you already had some baseline issues? Maybe you had some memory problems and couldn't remember that you've had a fall. Maybe you already have some problems with balance, and so you fall and you don't really want to tell people that you're having more falls because you're worried that, you might lose your independence. You have a motor vehicle accident and maybe it could be your fault because there's changes because you are older, or maybe because you have a disease in the brain and you don't want to report it. So of course, that puts people at risk of repetitive falls. They're also at increased risk of intracranial bleeding because a lot of older people are using blood thinners. And also because there's more shrinkage of the brain when you're older, just a fact of aging, you're also at increased risk of a bleed. So making a diagnosis of concussion in older people is actually not that easy. Next slide, please. And so many concussions are missed. And as I mentioned, many are not reported, even if they're, not forgotten or feared. But it's also important for us to think about, well, if somebody has a memory problem and you see bruises on them, where did they get them? And that there can be gaps in memory, that a lot of the medications that we sometimes prescribe and some of us take can cause our blood pressure to drop or cause us to be slower, which puts us at risk of falls. Next slide, please. So I looked through my clinic at first 300 and then 1,000, and there were almost no referrals for people who are in the highest group of having falls and possibly concussions. Luckily, there has been some increasing awareness, and so the numbers are increasing, but still a far cry from the numbers of referrals I get for people who are less than the age of 65. Next slide, please. And so one thing to always consider is that changes occur after a concussion, and older people are not protected against those. And one of them are these neuropsychiatric symptoms. And so it is common to get post-concussion depression, anxiety, irritability. And if you look in older folks, if they've had concussion, there is a much higher rate of depression if you had a fall versus if you have not. And what about another group? Okay, I think the other group that is often misdiagnosed is our women, mostly women, but also men, unfortunately, also suffer from this, from intimate partner violence. The numbers are actually staggering. Intimate partner violence is not a rare event, traverses all socioeconomic boundaries, affects 1 in 4 women in their lifetime. There's a lot of hits to the head. Unfortunately, in women, it tends to be more of a serious violence, although the number of spousal violence, the actual prevalence seems to be equal between males and females. Next slide, please. So in terms of concussion or mild traumatic brain injury and intimate partner violence, you have to remember it's actually usually missed. People focus on the bruises, the fractures. They misdiagnose the mental health. There's actually very few concussion referrals. I can count on one hand, actually, the number of referrals I have received that were directly related to a concussion from intimate partner violence. We sometimes discover it, but it's actually very rare to get a referral on this. Next slide, please. So, of course, you know, a hit from intimate partner violence can also cause a concussion and can be associated with fatigue and depression and memory loss and poor judgment. Survivors of intimate partner violence can present with other symptoms like mental health symptoms or addiction. The diagnosis is difficult because it can overlap. Being in a violent situation can give you post-traumatic stress disorder and, you know, lots of psychiatric symptoms. And of course, that would overlap with what you end up with from a concussion. And so it's critical that these people get identified and that you address the psychological and physical concerns and obviously, you know, get them out of harm's way. Next slide, please. So what goes on when you have a concussion? Actually, there's a lot of unknown. We have active research programs because there are so many things that have been implicated. And, you know, when we talk about concussion, and then we talk about all the symptoms that result, you know, one of the concerning things is, as Tim has alluded to, and I'll talk to you about more later, is that, you know, neurodegenerative disease has been now associated with concussion. And so there's a lot of work trying to see how these things tie together. Next slide, please. So in 2020, brain injury made it to the list of modifiable risk factors for neurodegenerative diseases. And so even a single mild traumatic brain injury, concussion, increases the risk of dementia. Obviously, the more of them you have, the higher the risk. Next slide, please. And so head injury now made it to the list of modifiable risk factors and joined the ranks of things like smoking and depression and diabetes and hypertension and physical inactivity. Next slide, please. Chronic traumatic encephalopathy is actually the one that most people talk about, and this has been reported mostly only in athletes who have suffered repetitive head injuries, and a lot of them are subconcussive, although they, of course, some of them do describe concussions. It's a progressive neurodegenerative disease that, you know, looks a lot like Alzheimer's disease, but is in slightly different parts of the brain and is slightly different. You know, we think of a different strain of tau than Alzheimer's, but has many similarities, and usually was found in boxers, but in hockey players, football players, soccer players, a few cases in the military, mostly those who had already some sports in the past. Next slide, please. There's a large study that was done actually in Canada, in Manitoba, that showed that your risk of Parkinson's disease, dementia, attention deficit disorder, as well as mood and anxiety disorders was significantly elevated if you had a history of past concussion. This is actually out of Manitoba. Again, some of the administrative data that's come out of there. Next slide, please. There is a lot of evidence that has been accumulated that mild traumatic brain injury can increase your risk of Alzheimer's. Of course, this isn't easy research to do. You know, you think of an injury, which of us has not suffered a concussion? I mean, most of the time, you were a child and you fell and you don't even remember if you had them or not. So this isn't easy research to do, but there seems to be, you know, multitude of converging evidence that having a past history of a mild traumatic brain injury can increase your risk of Alzheimer's. Next slide, please. Also, Parkinson's disease, large grouping of patients compared to people who didn't have a history of traumatic brain injury. Again, higher risk if you had a past traumatic brain injury of developing Parkinson's disease. Next. This study, however, did not separate mild from moderate or severe traumatic brain injury. Next slide, please. ALS, again, lots of converging evidence to show that there's a increased risk of ALS when you have had a past concussion. And in next slide, yeah. And having a concussion can change the course of the disease. So faster progression of cognitive issues in Parkinson's disease. Next slide. Earlier onset of Alzheimer's disease and more amyloid in the brain, one of the Alzheimer's pathology. Next slide, please. So means that when you have had a brain injury, you have to remember that, you know, that risk, you've already accumulated it. So that means that there's other things that you really need to focus on to try to mitigate that risk. And so we really promote brain health activities. We know there's a lot of evidence that physical activity, especially cardio, aerobic exercise, running, swimming, dancing, can slow down this disease, delay the onset of neurodegeneration. Education, lifelong learning, controlling high blood pressure, diabetes, quit smoking, reduce alcohol. The new guidelines, maximum of 2 a week, 0 is actually better. You know, being socially active. So these things we want people to focus on. Next slide, please. And so to summarize, concussions are common. There are special populations that have to be considered where there's lots of concussion and they're being missed because concussions have been implicated in neurodegenerative diseases. People talk about chronic traumatic encephalopathy, but they're actually implicated in all of them and can change the course of the disease. And, you know, so it's important to recognize that you have a concussion and then, you know, focus on things to do to promote your brain health. Next slide, please. That's it. Thank you.
Well, whoops. There we go. Thank you for that. There's a whole lot of what happens and then what you can do. And I think it's, when we were speaking in preparation for this webinar, I think it's sort of, you had a great analogy, Dr. Tartaglia, about your baskets. You know, if you have had a brain injury, you sort of have to double down on other things that you can do to improve your chances of better brain health. So that fits really well with what we do around awareness. You know, we point out risk factors to people all the time and what we don't want to say should and shouldn't, but really it's about increasing your chances for better brain health. These are the things that we can manage. And so we like to encourage people to do those things. I think it's interesting, you know, brain injury makes sense. I don't think anybody would ever think that a blow to the head is a, you know, a good thing for your brain health. Certainly interesting to know that sometimes it's not directly to your head, but you're saying that there are other impacts to the body that can have an effect. And that, you know, many of us don't even know. We would be too young to remember some of these things, or the culture was that you were just supposed to shake it off and move on. So I think it's really interesting, and we have some really good questions that have come in here, some of which you've addressed, but I think are worth calling out between you. One of the questions, I have some questions too that we'll come back to, but some of the ones that came in before the event were, how does the frequency and severity of concussions affect one's risk of dementia? I think it's certainly an increased risk factor.
Yeah, I mean, it's, you know, as I mentioned, these are hard studies to do, right? Like we, you know, a lot of the studies are administrative databases, but think about what that means. You know, you go to your doctor and you complain about a headache. And so that could get coded as a headache, but actually your headache was because of a concussion. And so, you know, it's not so easy to figure out what's the relationship, you know? Is it one-to-one? No. There's people who will not get dementia and they've had many concussions. That's like saying, well, you know, there's smokers out there who don't get lung cancer. I think most of us think smoking is bad for you. So I think we can say, you know, try to avoid concussion as much as possible because a brain injury is not good for the brain. The more you get, the worse you get. And as Tim already alluded to, you know, you're getting these subconcussive blows in some of these sports where it's repetitive head injury, and that can set you up for really detrimental effects. I don't know if Tim has any comments.
Yeah, I'd like to comment that. So one of the things that you see when you look at the data is, and this could be heading in soccer, this could be tackling in football and rugby, this could be body checking in hockey, is that young people who are exposed to repetitive head impacts, and remember, it's not just concussions, it's repeated blows to the head, whether they result in a concussion or not, that's really your risk factor there. But if people have participated in these sports before the age of 12, they tend to do way worse. In other words, they tend to have worse long-term symptoms. And so that's why we are strongly advocating, and it's deliberately provocative title, a policy change called Stop Hitting Kids in the Head. And, you know, because of the work of Dr. Tartaglia and our group in Boston, I think a lot of people know that football participation, and look, this is a game I love. It's a game, you know, I enjoyed playing, but children before the age of 12, and we actually advocate for 14, just to be on the safe side, should not be participating. It's the risk factor is just too high. And so that's one thing to remember. And when we think about Canada, because there's actually not that much football participation here, actually the biggest policy change that we can make that will have the greatest impact is to take heading out of soccer. So they've already made this change in the US starting in 2015, where they banned headers for participants under the age of 12. They recently made that change in the UK as well. In Canada, we're now lagging behind. Just to give you a sense of the numbers, there's 550,000 young athletes that participate in hockey and 750,000 that participate in soccer. So bang for our buck, that's the single biggest policy change that's going to be able to help athletes going forward and reduce the risk of chronic traumatic encephalopathy and associated issues such as dementia.
Tim, I just wanted to clarify or ask about one thing. You said kids under the age of 14 shouldn't be participating. I think it's participating in the contact aspect of the sport.
Exactly.
You can play other forms, but
in activities where they're exposed to repetitive head impacts. Correct.
Right. Not a good idea. I'm wondering if you would talk a little bit about Rowan's Law and that example. You touched on it, but I think, you know, here we're talking about the risk of dementia and what happens down the road. But I think maybe telling us a little bit about that and the intent and what is treatment today? And does it depend on the type of impact and concussion? And that's maybe a twofold.
Sure. So again, there's an Ottawa part to this story. So I mentioned before the unfortunate story of Rowan Stringer and the wonderful advocacy of Gordon, Kathleen, her parents, and Cassie, her sister. So Lisa MacLeod, who's the MPP for Nepean, was actually the advocate for this. And just for reference, there is now some form of concussion legislation in all 50 states in the United States. So far in Canada, there's only one province that has enacted any sort of concussion legislation. And I happen to not be a fan of big government or overreaching laws, but I think the analogy here is the success of the seatbelt law. And one of the issues that we see in the other provinces and the canned response of why there has not been legislation enacted is that they don't feel like it's a serious enough issue to merit legislation. And I actually think that's exactly the problem, is that we just don't take this injury seriously enough. And so enacting a law, this is not to put people in jail, but this is to emphasize that this is an important thing. And when you look at Ontario, at the heart of the law, it's when an athlete receives a suspected concussion, they're removed from the field of play or the ice or the court immediately, and they need to get cleared before that they return to play. And so, in my opinion, this is something that should be done across Canada. I know there are several others in the space that agree with me on this. And again, something that can be done immediately that will help people decades later.
great. Yeah, it's such an important piece of legislation that I know you worked hard with a local MP, Lisa McLeod, so thanks for that. Sorry, Dr. Tartaglia, if we can just go back in terms of treatment briefly, is there sort of a one size fits all right now? I know it used to be that you sat in a dark room. I don't know. I don't think
Yeah.
that's the current wisdom.
Yeah, so that's the thing we don't do anymore. I don't know that there's a one size fits all. That, you know, we think of, you know, brain disorders. That's where we need personalized medicine the most. So you actually have to get a good history and figure out what's going on with the person, what are their symptoms, and we do you know, a symptom-based approach. So no, there is no one size fits all, but the one thing that has a lot of evidence and that we do prescribe to everybody is physical activity. We know that people who do exercise, you know, and that's low impact exercise, making sure not to exacerbate your symptoms too much. But low impact exercise has gained a lot of evidence that it helps the recovery of concussion. We also know that people who can get back to work in modified duties, with accommodations, they also do better. That includes people going back to school. So the current thinking is actually getting the person back out there. The rule of rest probably came out of sport, where it made sense. You did not want somebody who got concussed during a sport to go back out into the sport. So rest from that sport. Unfortunately, it was changed, altered without any evidence, really, and became kind of the rule of law. That was the prescription people got. That just goes to show that you really need to do research and you need evidence before you make recommendations for people.
Right. And is the sort of light exercise, is this related to promoting good blood flow to the brain in any way? Because we know that, you know, when we think of other risk factors like diabetes and heart disease.
Yeah, some of it is actually, it is better blood flow to the brain, but where the growing evidence is actually these factors that get released when you do aerobic exercise. So that's one of the reasons the evidence for aerobic exercise and brain-derived neurotrophic factor and vascular growth factors is much better than in resistance training. So these factors actually promote blood cells to grow. They promote new cells to grow. They promote synapses, connections within the brain to help you learn better. So there's a lot of evidence that exercise that gets the blood flow going helps much more than just, you know, getting your blood flow going, which of course we think more oxygen to the brain, that must be better.
Right. Great.
I just like to
go ahead, Tim.
echo what Dr. Tartaglia is saying and what you're saying. And if it sounds like we're all reading from the playbook, it's because it's the same playbook. It's because, at a certain extent, we are. And so I'll just tell you, you know, from real world situations, when we're dealing with military personnel, when we're dealing with athletes, when we're dealing with accident or violence survivors, and we're trying to help get them better through our program, which is called Operation Brain Health, which has a lot of the tenets of what you see on the screen and a lot of what Dr. Tartaglia has mentioned. In just very practical terms, we recommend going for a walk every morning. And for some of those folks that are really suffering, that are having a hard time, whether that be mental health issues, whether that be dementia, it's getting up first thing in the morning. It's one of our veterans talks about: put your shoes next to the door, have your sweatsuit ready to go next to the bed, get up in the morning, get dressed, and get out the door before you do anything else. And even if it's just walking down to the corner and back, if that's all you can manage, then that's what it is. But for all of those people that I've mentioned that have put that in practice, it has all been helped them significantly. So I cannot advocate that enough. Is that exercise, and it can be as simple as a short brisk walk in the morning.
Right. That's great advice. And if you can say hello to someone along the road, then you're getting some social interaction too, and that makes you feel good.
Or even
And
better,
that's important.
walking with a partner. It makes exercises way easier when you're doing it with somebody else, and then you get the double whammy of both the exercise and the social connection, which also absolutely is a positive factor.
Exactly. You're filling your basket on the other side, improving your chances. We have some very specific questions that are maybe getting a little deep into some personal information, but there's an interesting one. Are people with post-concussion syndrome more susceptible to long COVID? Would there be any data on that or anecdotal evidence?
Yeah, so the issue is that the symptoms of long COVID, some of them, and the symptoms of, so let's say somebody who has mild COVID, okay? Because if you end up intubated and you know, stroke and stuff like that, that's different. But people who had mild COVID don't get hospitalized. Post-COVID symptoms actually overlap greatly with post-concussion symptoms. So post-COVID headache is very common. Post-COVID brain fog, concentration problems, anxiety, post-COVID depression. So that's the issue. And so it's not clear that you are more susceptible, but if you have long COVID and you hit your head, well, the symptoms could get worse. If you've had a concussion, you're trying to heal from that and you get COVID. So I have a concussion clinic, and I started a long COVID clinic thinking naively that it was going to be a very transient clinic. You know, and the reason I had volunteered myself was because people were coming to me with the same types of symptoms. And I was saying, okay, I think I could help there. So I'm not sure that one really sets you up to be more vulnerable, but the symptom overlap is so incredibly tight that you could imagine how confusing it would be.
Yeah. Oh, interesting. Okay. Of course, there's anecdotal for sure. That's great. Another question, someone who's had multiple mild severe concussions through childhood and their teen years is now in their 30s and experiencing some brain fog. Should they get assessed?
So I see the question. It says, "Sir, get assessed for early detection."
Sorry, yeah.
Yeah, so I'm assuming you mean early detection of dementia, and no, I would not say that. So in dementia, you really have to think about what the cause is. And, you know, those are neurodegenerative diseases for the most part, okay? Neurodegenerative disease is a progressive disease, is not episodic. So unfortunately, our diseases don't come and go. They're there and they progress. You can change the progression rate by doing some of the things that you have on your screen, but it's not coming and going. So I would be looking at other factors that could create this intermittent brain fog, but I would not be worried about dementia.
So I'll answer that from my own perspective. So if the risk factor is how many times you've been hit in the head and how hard you've been hit in the head as somebody who played football and hockey and soccer and rugby, there's, as I mentioned, there's low risk and there's high risk, and I'm somewhere out past the high risk in a space that very few others after 10 years of professional football. So it's certainly a concern for me. What you can do for that is the stuff that, again, that you have up on the screen, is really focusing on your health, is just making sure that you're exercising, making sure that you're eating properly, to say it in just sort of simple terms, following the Mediterranean diet, really working on your sleep, working on your cognitive reserve by doing things like reading and playing chess and doing things that stimulate your brain. And if you're doing those basics, you're already going a long way into helping your brain be healthy.
Right. That's actually, I think, a good segue into one of the other questions, which is about the genetic link. Somebody's asking if a person has had a concussion and a parent or close relative has dementia, do their chances increase? And Tim, you had some interesting things to say about that in your own experience, and I'm sure Dr. Tartaglia.
Yeah, I'll let when we got a scientist on the panel, I will let her handle the science questions, and yeah, I can speak to my personal experience again after that.
Yeah, I think that's a great question. And I think an active area of research. You know, as in anything, we have a fundamental basic risk related to our genes for everything, right? Like you have 10 people walk in a room, you know, 2 get COVID and die, 4 get COVID and don't even know about it. You know, the other ones get it to some degree. So of course, everything that happens to us is an interaction between our genes and our environment. So in concussion, we have some data and you know, not strong data, but just some suggestive data that the risk factor for many of the neurodegenerative diseases, which is called ApoE4, it's a type of allele, it's a type of, let's say, a modifying risk gene, okay? Does seem to increase your rate of accumulation of this tau in the brain as measured with imaging. That isn't the same as saying, oh, yes, for sure. A risk, you know, even as a risk for Alzheimer's, it's just a risk factor. It doesn't give you Alzheimer's. It's not like that kind of genetic disease. So I think it's a great question. And I think in the future, we will see that more and more, there may be an interaction that certain genetic makeups are more at risk of concussion, the subsequent effects of concussion, and maybe some neurodegenerative diseases. Because definitely, you know, there's millions of people get a concussion, and only a smaller portion of them actually get post-concussion symptoms. So I think there's a lot to be learned in this area, an active area of research. So great question. I'll let Tim.
Yeah, I absolutely echo that. You know, I think there's no way we can say that definitively at this point. And you know, certainly when you look at other diseases, we know that genetics are a factor. I think that's about as far as we can go. I mean, it's one of the questions that you know, certainly I consider is why is it that, you know, I see people coming in through our helpline all the time? Why is it that I have, you know, friends and former teammates who are in our brain bank who were exposed to much less impact than I did? And I had a father that was also an athlete, played lots of contact sports, played university football, and he's now a practicing trauma surgeon in his mid-70s and has showed, again, is just totally asymptomatic when it comes to this, just like I am. So, you know, that's the potential of that is very positive for me. That's you know, certainly a positive factor in the face of, you know, elevated risk, which is great for me. And I'll just say that we are very, very fortunate here in Canada. Then when you look at the world of concussion and chronic traumatic encephalopathy, we have absolutely fantastic clinicians and research happening here in Canada. You know, some of the leading researchers in the globe are right here, and some of the leading clinicians in the world are right here. And so we're very, very fortunate to be in Canada when it comes to this issue.
Indeed. I think we'll just do one last question here before we wrap up. Are there any promising studies on treatment to undo the damage of brain injury?
Well, maybe I can start. I think, you know, there's data. So I'll answer that in 2 ways. The link between concussion and neurodegenerative disease means that what we're going to focus on at the end are the neurodegenerative diseases. And so, yes, there is, you know, we have a lot of optimism that we have, you know, some drugs that actually have been approved for Alzheimer's disease can change the course of the disease. So we are making some headway. I don't think we're there for chronic traumatic encephalopathy and many of the diseases, you know, any of the diseases, we don't have the miracle cure. But there is a lot of research and there's a lot of help. In concussion and the symptoms that come about after concussion, we actually have many really good treatments. We have good treatments for headache. We have good treatments for depression. We have good treatments for anxiety. So we're doing well there. I think where we're lacking is, how do you go from a concussion to any of these neurodegenerative diseases? Because the hope is, once you could figure out those steps, you could stop some of them. And that's where we really need much more research. We need more research dollars in this area. The brain has not received the same attention. We have huge gaps in our knowledge. And until you understand something, it's very difficult to treat it. So I can be optimistic, but we're not there yet. And
Tim, did you want to add anything?
No, I think Dr. Tartaglia said it.
Okay. Okay, I fibbed. I said we were going to end it there, but there's some very specific questions, and this one's rather curious to me. Could you expand on the glutamate excitose toxicity mentioned in one of your slides? My daughter happened to start a low glutamate diet after her concussion for other reasons, but noticed significant improvements in her concussion-related symptoms.
yeah, so we're actually not talking about the glutamate in your diet. This is the glutamate that's in our cells and not going to be affected by the glutamate in the diet. But of course, there's something about that diet that may have been beneficial to her daughter or his daughter. But it's a different type of glutamate. The glutamate that we are talking about is what is actually in all our body, in all our brain cells, and a very important factor, but seems to maybe get released in excess when there's an injury. And it's a hypothesis, is not proven, but not related to the diet that we ingest. Yeah.
Okay, great. Thank you for clarifying. So thank you everyone for all of the great questions. We didn't get to all of them, but they were really good, and in many cases not anything that we could have anticipated. So thank you for participating in that. But people have asked for the infographics, the Knowing Your Risk Factors. Just want to let you know that these are on our website, on the Dementia Society's website, which is dementiahelp.ca. And they are in our Learning Hub. We have a Learning Hub that we launched earlier this year, which has 23, sorry, Herman, thank you for following along with me with the slides. We have 23 modules that are designed to be about 15 minutes in length. They are self-paced in both languages, English and French, available on our website, dementiahelp.ca, under the educational tab. And so all of the topics are aligned along the spectrum of from healthy brain through later stages of dementia and dementia care. So you will find that information in there to look at again, and some brief modules encouraging you to be brain healthy. So you'll find that on our website. What did we have? We had, yeah, we want to just ask you a few quick questions to all of the participants on the survey, because your opinion matters to help us program future events. We have a women's brain health series that we run, and we occasionally do topics like this that we know are of interest to people. So quick questions to help us program future events and to know whether or not you found today's event helpful. So if you wouldn't mind filling that in, we would really appreciate it. If you don't get a chance or you want to tell us anything else, we will be following up with an email tomorrow or in the coming days. We will also provide you with a link to the recording of today's webinar. So look for your follow-up email with that link earlier next week. Don't know if we need to give people a few more minutes or if we're good, Herman. Yeah, we just want to remind you to stay brain healthy, know your risk factors. And I want to thank very much Dr. Carmela Tartaglia and Tim Fleiszer today, for this evening rather, for coming and telling us about the risk factors related to concussion and brain impacts. Remind you, if our canal freezes over anytime soon again and you're going out for a skate, protect your head. I know I started wearing a helmet in the past couple of years just because of the work that we do here, because if you can do something to prevent it, why wouldn't you? So some helpful tips here, because we know the different environments. Buckle up when you're out in the car, use a helmet during sporting activities, and clear out the clutter. Make sure you're not going to trip in your home and bang your head, because sometimes it's the most banal things that can catch us up with brain impacts. So once again, thank you very much. Oh, There we are. And if you haven't found us yet, you can come and visit us at our new Dementia Society Center out in the Ottawa Business Park on Saint Laurent Boulevard. We're available 5 days a week to support you if you have any questions. And our website, like I said, is a wonderful resource. So please use it. And I hope you'll come back to another webinar sometime soon. Thank you very much again, Carmela and Tim. And thank you, everyone.
Thank you.